Hey everybody, this is Dr. Joe Borio with this week's Change Your Health, Change Your Life. I want to talk about a topic today, which is fibromyalgia. And I wrote down some notes on it. I want to make sure I get all the facts straight with you because it's something that has been really under controversy and whether or not it exists, what is it exactly. And I think the reason being is it's really a question of what the cause is. So it's not a question of whether or not people have it, but it's something that you can't measure exactly. It's not like you take a blood test and say, hey, this is positive, so you have it, or an MRI or a CAT scan, and say this is what you have. It's really under clinical evaluation or clinical diagnosis, meaning you have to have a series of certain findings within the practice, or when you're in the practice, you have to have certain clinical findings to say, hey, listen, you meet these criteria, and therefore we've excluded everything else, and this is what we're going to diagnose it as. So that's really one of the reasons that it's been under controversy. It's been officially diagnosed as a condition since 1990. And what it really is it's a chronic pain syndrome. So you've got many areas throughout the body. If you divide the body up in quadrants, you've got a series of tenderness in all quadrants where you can have up to 11, up to 18, a minimum of 11, up to 18 areas that are tender in those specific points. Now, the cause, again, is not something that's fully understood. What we do know officially is that there's multiple causes, but typically fibromyalgia presents itself most commonly after a trauma. So there's usually some type of a trauma that occurs to the body before we start to see the onset of these symptoms that are, again, evaluated clinically in the practice and then determine whether or not it is this or it isn't this. And that's really what we commonly see with the practice. Now, we also see other things that go along with it. We see people that typically have fatigue issues. We certainly see people with sleep disturbances. We see it commonly with depression. We see it more commonly with women than in men. And it can be mild. It can be episodic, meaning it comes and goes. It can also be very debilitating for people, meaning that it becomes very progressive and debilitating to a point where people can't really get beyond it. What we see through a lot of research, when I look through all this research, my God, there's so much research and so many notes I've already taken, is that the typical approach to fibromyalgia through the medical system, if you will, is the paradigm of answering the problem with drugs, often surgery, often very invasive type approaches. And what we find throughout all that, the majority of cases are failures under that medical approach, meaning people don't find that there's any benefit. In fact, most often you find these effects to be dangerous. For example, if you just look at the effect of aspirin, we've got 30 to 40% of all hospital admissions for bleeding ulcers are the result of aspirin. People taking aspirin, it eats a hole in your stomach, it's also a thinner, so between the two of them it causes a lot of problems. And that's just aspirin. We're talking acetaminophen, which is often seen in Tylenol. That is the number one cause of liver failure in the United States. And I can go on, and this isn't something to bash medicine or to bash that paradigm. What it is to say that, look, if we're going to look statistically at that approach, it hasn't been shown to be very, very effective. So if we step back now and say, okay, let's try to find some causes to fibromyalgia, what we're finding is it involves the nervous system and it becomes a hypersensitivity of the nervous system. So what the heck does that mean? That means that nerves are irritated, stretched, there's some type of torsion that occurs to the nerves, and as a result, the nerves become hypersensitive, meaning that the same type of stimulus, if I touch the normal nerve and I touch you here, you may feel light pressure. But if we've all experienced, if you pull a blister off, for example, you get cold or hot or pressure on that really hypersensitive skin, all of a sudden it becomes magnified where it feels more cold or more hot or more sensitive to pain. That's what happens with hypersensitized nerves. So if I have those throughout the spinal cord and those nerves happen to map out my hand or my neck or my mid-back or my chest or my neck or jaw or my legs or my abdomen, that same amount of pressure will cause a significant increase in the amount of perceived pain. So that individual starts to develop a lot more discomfort or pain as a result of that same amount of pressure or stimuli. And that's what we're seeing as the cause of it. Now, what may lead to that, again, is it most often follows trauma, but we can also see that it often follows depression. It often follows different types of hormone episodes in people. But the most common event is typically following trauma, and it's typically more common in females than in males. So looking at that whole approach, if we know that there's sensitivity to the nervous system, and you read all these doctors talking about the interpretation of the deficit of the nervous system, that there's oversensitivity in the nervous system, that's Dr. Gunn. If we look further into seeing the traumas, if we look further into seeing academy pain research, we're also in these neurosurgeons and these neurophysiologists and anatomists, we're seeing that the nerves are being compromised or compressed, causing the sensitivity, which then often leads to the hormonal change, the sleep disruption, the digestive disruption, and so forth. So, as a chiropractor, most specifically, we want to look towards improving the function of the nervous system. Now listen, unfortunately, the way that chiropractic should be viewed is really not a treatment for anything in one specific thing other than the identification and correction of areas of the spine that are out of alignment. Now, the scientific name for that is subluxation. So what my job as a chiropractor is to look for areas of neurological deficit, meaning areas of the spine that are out of alignment or not moving properly, thereby causing a loss of normal nerve function, thereby causing a deficit of that neuronal food, if you will. Think of nutrition as a nutrient, as a food, and therefore that part of the body doesn't work as well. If we irritate that nerve, it becomes hypersensitive, and therefore it leads to, in some cases, we're seeing that it leads to fibromyalgia. So as a chiropractor, my primary approach is to identify any areas of the spine that are out of alignment. Certainly we want to identify and map those to see if they coordinate with areas of affect the sensitivity, and then we want to adjust those areas to improve normal nerve function. Again, if the symptoms, if you will, of fibromyalgia don't abate, it doesn't mean you don't need normal nerve function to those areas. But the primary job of the chiropractor is to look to see if those nerves aren't working properly by means of any type of mechanical pressure, realign those areas, and then not only get the sick people healthy, but most importantly, keep the healthy healthy. So we look at those people and say, okay, those people are sick, we got to get them healthy, and then once they're healthy, we got to keep them healthy, and that means ongoing care. But again, when we step back and we look at fibromyalgia, we realize that it can be very debilitating. The other aspects, as I always talk about on our health videos, we got to talk about nutrition, proper sleep, proper water, proper exercise, mental thought, and then those real healthy adjustments in order to keep the nervous system healthy. Hopefully this has been real beneficial for those people that are suffering from fibromyalgia. What we want to work towards is getting the nervous system healthy, getting on a gentle exercise routine, putting good nutrition into the body, again, hydrating the body properly, making sure that we're not doing self-talk that's very negative to the body, making us more sick, and again, those adjustments. I can't stress those enough how vital they are for. If you guys want more information, certainly you can contact me in my office, or you can do a little research on your own at chiropractic and the caring for fibromyalgia, or the caring for the nervous system. In the meantime, guys, spend time with your family, enjoy a time with friends, and make sure you guys have a very, very healthy week. Don't forget that you and your mother and your father and your grandfather and everyone you know need to be under regular chiropractic care to ensure proper nerve messages for brain and body. Have a great week. I'll talk to you guys next week.